Welcome back, everybody, to the videos that are about vitality, balance, and getting your pets terrain or their inner selves to be as healthy as they can be so they can live a long and happy life. I love what Dr. Torraca, who we're talking to today, has on her website. And I'm going to read it directly. Well, let me introduce you first. This is Dr. Deb Torraca. Sorry, she's a doctor of physical therapy for animals. So her entire practice is based around getting animals physically balanced as best as they can be. And this is a quote directly from her website, that their goal is to give your animals the best quality of life for the longest time possible.
Absolutely.
So beautiful. Thanks so much,
You're
Dr.
welcome.
Sharaka. I appreciate you being here. So let's kind of start with an open-ended question. What's your conception of vitality?
So I think vitality, when we look, I mean, just in essence is life, so I know when I have an animal, and right now the owners are, of course, not coming into the clinic, but you look at the animal owner bond, and that's a big part of, I think, of the animal's vitality is how they're feeding off of the owner. I always tell owners, you are going to impact your dog with your behavior. If you're down, your dog is going to be down. So especially if the dog is healing from either an injury or surgery or just has a chronic illness, the way we approach it, we want to approach it positively, that, or with positivity, that we're going to do the best that we can to treat the entire body, and to really look at the health. And that always includes the owner. So one of the things I always tell the owners is, you may be taking care of your dog, but you need to take care of yourself in order to take care of the dog. And sometimes that gets lost. And I think that's part of this whole vitality when we look at that bond. And we're really working as animal practitioners, we're working with the animal and the owner. It's always the both of them, or maybe a family, working together. So, and then, definitely encompassing, of course, I look at movement and function, but things that need to be considered are the dog's environment, their food, their nutrition, any supplements that they're taking, their exercise, their home life, any stressors in their life that sometimes we forget about, whether they're environmental or brought upon by a family member, a new dog in the house, anything like that. So,
So you feel that vitality is the energy to live.
correct. Yes.
Okay, and that the energy of the guardians actually is related to the energy or the healing of the dog or cat or any
Absolutely.
individual.
Absolutely.
Okay, awesome, awesome. And you gave a couple of great ideas for building up that vitality with fresh food and
Mhm.
exercise and breathing. Do you guys do nose work? Dr. Taraka's clinic is the Wizard of Paws, so I should have introduced you as the wizard. I'm here
The
with the
wizard.
wizard.
Yes, and we do, like, as we discussed, especially during, this pandemic right now, and one of the healthiest things that, we can do is breathing, working on our lung exercises and also just centering. But, um, very often with dogs coming in, if they're anxious or, stressed in any way, we really want to try to get them calmed down, of course, working on deep breathing, which is, sometimes difficult for a dog. It's sometimes easy to tell a person how to breathe well, but, with the dogs, just calming down, and we'll spend a lot of time with lots of different relaxation techniques, just trying to get the dog to relax, because certainly, Once they start breathing well, then we're able to work better. The dog is able to work better. And we're able to just accomplish so much more with a relaxed dog.
So the vitality allows the dogs to their bodies to work better, to heal better.
Mhm.
Um, then what about balance? Now, how do you feel about the balance and how it relates to vitality?
So when we look at balance, I mean, both from a physical standpoint. So I always look at balance, and it's something we work on from week-old puppies to our 18-year-olds, our physical balance. And, as I had mentioned, I'm almost 6 weeks post-op, a total knee replacement, and I'm realizing how important balance is for so many things, from losing my balance my initial couple weeks and throwing me off and just feeling, um, and then starting to regain that balance. And even though it sounds kooky, kind of balancing again with the earth, if you will. So I just feel more secure that my balance has improved. I'm not fearful of falling. And I've been thinking a lot about my canine patients, especially with neurological issues, cruciate injuries, or myelopathies, and how their balance is affecting their life. So that's the physical aspect. And when we look at the rest of just balancing everything out between the vitality and keeping the livelihood of an animal, there are so many things to balance. As I mentioned, if we can get them relaxed, we're going to be able to do more. If we're working with an animal that has good nutrition, they're going to heal better. If they have a good immune system, they're just going to function better. We're going to see a significant improvement. So, you look at, I always think of physical balance, but then you look at everything else and, trying to establish that, that balance there.
So, and you mentioned food to heal. Do you have
Mhm.
any tips? Is there any particular brand of dry food or wet food or?
So I think it's always a tricky question with food, and definitely I am a raw feeder, but I do feed. I have been mixing kibble in with my older Cocker Spaniel. I think it has to be a good food. When dogs are healing, they're going to need more protein. Older dogs, a lot of the senior foods have more carbs and lower protein, which it should just be the opposite. We're going to need more protein. So when I'm looking at a neurological dog or a post-op dog, I'd like to see more protein, in their diet, as long as their system can handle it. And then antioxidants for healing, huge on that. I think that's a key, plays a key role.
So since we're on the topic, vitality in food, so the fresh or raw food compared to say the canned and dry food.
Mhm. So I mean, same. I take the same approach with myself and my family, that fresh food is best. So if it's coming like seasonal, so we're right in the middle of summer, there's so many incredible fruits and vegetables out there that we should take advantage of. um, it's so I definitely believe in fresh food. I try to stay away from canned and processed as much as possible. So um, yeah, and I feel the same with dogs. I know definitely we'll have some post-surgical cases that won't be eating or doing anything like that, and they'll want to try anything, kibbles and bits or something. But you want to get them off that junk food. Junk food is what I call it, both for dogs and for humans. So trying to get them off of it. But yeah, I think that's, you are what you eat. And I think the animals are that as well. So it's important. And I could always tell in their coat, their eyes, everything, their food and their diet. So
And before we get off the balance topic, any specific, individual ways to physically balance that people can maybe do today?
Yeah, so something that I always have owners start with their dog, and it's pretty simple. So a dog normally puts 60 to 70% of their weight on their front legs and 30 to 40 on their rear. And while the dog is standing, if we just ask them to lift their head up without sitting, we have a transfer of weight to the
Hmm.
rear. With us, we transfer weight to our heels. And then when the dog looks down, they transfer their weight onto the forelimbs, and we do it to
Hmm.
our front feet. So that's something, easy that we could do with dogs is shift them back and forth. And the key is not to have them sit. So just transfer them back and forth and work with that. So that's something simple to do.
Fantastic, thank you. So we have a bit of a grounding for vitality and balance, but what about stressors? You mentioned stressors, and I want to just focus right now on stressors like infections or germs. Um, how do you consider germs compared to vitality balance in the individual?
Yeah, so I mean, germs in many different ways can impact the dog's life and their whether they're healing or we're conditioning. I work a lot with show dogs, and the owners and handlers will often think I'm a little crazy when I'll advocate starting a great antioxidant program while the dogs are on the road, because they can pick up so many things. I've had my own previous dogs come home with, the cooties, from the dog shows, but that can definitely, have an impact on vitality and set things back. There's so many things that dogs can pick up from, especially if they're in a vet hospital having surgery or they're in a home with multiple dogs, and that will definitely have an impact on their healing and their overall life. So absolutely.
So, well, in a related question then, do you have any feeling for why one dog might get sick? Let's say there are two dogs that go into the kennel and one gets kennel cough and one doesn't and have equal exposures.
Yeah, so it's a good question. I've had it, or not. I haven't had kennel, but my dogs have had it. And I remember at one time I had 8 dogs in my house. 4 got it from a dog coming home from the dog show, brought it home, and the other 4 didn't. And it was interesting. And as I followed the dogs, I mean, certainly the dogs that didn't get, I think, had they were all eating the same, so that was all. Uniform, but I think their immune system, their stress level, the 4 dogs that were my stressors, their mental stressors, were the ones that got it. So I, think that plays a big impact in that. So looking at again, their stress and their body and their health. So
And their balance.
and
I
their
guess
balance.
it sounds like that was a great. Are you saying that you had 4 anxious or stressed out dogs and they were, wow,
Yeah, they were the
they're
ones.
the ones that got sick?
Yeah, with the exception of the show dog, but the other 3, they were my stressor dogs. They were the ones, and even now I look in my household, I have 2 Clumber Spaniels and an older Cocker Spaniel, and the Cocker is definitely anxious, and, I know when he's stressed just from his bowel movements, from, his whole anxiety, and it's uh, interesting to watch. But and then the Clumbers who nothing seems to bother, the Slimber Clumbers.
And I guess my last question for today relates back to vitality again, and that is the relation between vitality and the cellular energy that, that are in all of our bodies, all of our animals, all living beings need to work.
Right.
And I'm wondering if you see or accept any connection between that energy, that vitality, and symptoms.
Oh, absolutely. And I think a great example. So when you look at cellular vitality, so all of our cells need to breathe, need oxygen. We need sunlight. And we had just taken into a clinic a dog that had been hospitalized for 3 weeks. So the dog probably did not see daylight, was in a hospital environment, very stressed. And when I looked at the dog, that just the impression I got was everything was closed down. So, and the dog had a hind limb amputation. So if you can imagine, just everything was kind of compressed. Um, Once we got the dog, and I actually treated the dog outside because it was a beautiful day out. And I said, let's start to get natural sunlight. Let's work on this dog just being a dog, because it has spent so much time just in this compressed area, and I felt just not getting the energy she needed for healing, for everything. And within 48 hours we had a different dog. But just the her vision, her movement, her will to get up and move and to interact and to eat um, was significant. So I think when we look again, the whole body, um, I see a lot of orthopedic injuries. And yes, the dog may have just had a repair for a cranial cruciate injury, but we're treating the whole dog, not just that leg. So we have to look at normal activities, breathing, going for a walk and sniffing, just getting, that through there. And that's going to enhance the whole healing so much, and just the whole, keeping the body balanced.
Wow. Well, that's awesome. Thank you. Thank you. Thank you. I really
You're
appreciate
welcome.
it. You are indeed the wizard.
Thank you.
And I'm sorry, your website is Wizard of Paws?
Wizardofpaws.net. Yeah.
.net.
Yeah.
So thank you again, Dr.
Thank you.
Torraca. That was awesome. And we will talk soon and heal well and
Thank you.
be well. Thank
Thank
you.
you. Sounds good.
Bye-bye.